The Honourable Member for Abitibt-Témiscamingue. Thank you, Mr. Speaker. First of all, I wish to inform you that I'll be sharing my time with the member for Chicoutimi-Le-Fjord. Now, that being said, I will begin my speech. First, I would like to come back to the legal situation. Bill C-2 imposes so many legal conditions or so many legal considerations that it will become virtually impossible for a supervised injection site or anyone wishing to start one to meet all of these requirements. And in the event that they were able to do so, the minister could still, at the end of the day, decide whether yes or no a site can go ahead. So this doesn't make any sense. In fact, it's a bill which tries to hide the fact that the government does not want any supervised injection sites. So the bill is so complicated and the conditions so onerous that it will be nearly impossible to meet them all. I think the member for Gatineau demonstrated this clearly in her speech. So I won't address the legal matter farther. Rather, I will talk about the supervised injection sites themselves, what they do, and I'd also like to talk about addiction. I understand that these supervised injection sites are based on an approach developed by health professionals, and this approach is called harm reduction. So what it really means under this approach is that some behaviors which we would rather not have will happen anyway. So what is done is that we're trying to contain this behavior to try to minimize the negative consequences of that behavior. For instance, the transmission of sexual diseases. Even if you tell people, young people, not to have sex, well, they'll go ahead and have sex anyhow. So if we know they're going to have sex anyhow, we want to make sure that condoms are available in schools and that young people have access to them. So this is what the harm reduction approach is all about. For instance, drinking alcohol. We can tell people not to drink alcohol, but it's not going to work. People will continue to drink alcohol. So it's not effective to tell them to stop. So if we know they're going to do it anyhow, we can ask them to moderate their alcohol intake and not to drink and drive. So we will try to reduce the negative consequences of people imbibing alcohol. And the same with drug addiction. We are there to provide them with treatment. So at least with this approach, we won't be burying our head in the sand. So the same thing applies to supervised injection sites. We are trying to reduce the negative consequences of addiction. And there are consequences, of course. For instance, people can overdose. People can die from a drug overdose. This is one consequence. There's also the matter of disease transmission when people share their drug paraphernalia. You also have to understand that in these that some people will engage in prostitution to pay for their drug dependency, and so these supervised injection sites, for instance, will pass out condoms to prevent these diseases from being transmitted. And if a person goes to a supervised injection site, we will the emphasis will be on containing damage, on keeping syringes and throwing them out in the site rather than being littered in public parks. So often addicts don't take care of themselves, and so if they would go to a supervised injection site, they might realize that they have a growing infection, pneumonia, for instance, and they will receive treatment, and they will be encouraged to take better care of themselves.
At these sites, well, to date we know that people were going to be shooting up anyways, regardless of what we do, the efforts to encourage people not to do so, they will inject drugs. So I've studied the matter, but there really isn't another solution, in my view, that's safer. Now, if we tell people go home and shoot up, well, there's a higher risk of an overdose and of there not being anyone to intervene or to help out. There are other people who are going to be shooting up in the streets, injecting drugs, and they'll throw the syringe out and a child might discover it. Some people will go to improvised apartments where they can shoot up. And so at present, the best place is in a supervised injection site. Now, I don't know if members of Parliament realize this, but in hospitals, the boxes containing hazardous waste are locked. Now, that might be odd, to some. Now, do you know why that is? Well, it's because if those boxes aren't locked, people will steal syringes and paraphernalia, whatnot, steal the boxes to use the equipment in there. So we need to ensure that those kinds of disposal boxes are locked. And, Mr. Speaker, it's also important to understand that it's not just in large cities that this problem exists, unfortunately, in my region as well. Now, I work with nurses who work on the streets, and there's a system of to distribute new syringes to prevent infection, but even in Abitibt-Témiscamingue, which is a rural region, this problem exists, so we can't have our heads in the sand. Now, concretely, what I'd like to explain to people is that when someone goes into a supervised injection site, you can't just say to them, well, everything you need is over there. There is an assessment that is conducted through the initial contact. If a nurse sees someone come through the door, well, nurses always assess people's state of health. It's a bit of a flaw that we have. We always do that. We look to see if their situation is, or if they're looking very tired. We ask them if they have a place to sleep. We look at the way they walk. We can see maybe they've got an injury somewhere, and they don't necessarily want to go to the hospital, so we can step in and make recommendations. Now, if they seem confused, if there seem to be symptoms of mental illness, depression, we can provide advice. And that just takes a few seconds to assess someone. It's a very quick assessment for someone who has a trained eye to realize that those kinds of health problems exist. Now, we'll sit down and talk to the person right away. If they're coughing, wheezing, having trouble breathing, we may identify another health problem. If they've got, for example, a skin infection, we can see it. So that in and of itself, seeing the person on site, the person hasn't injected any drugs, but there is a regular health assessment by a nurse who is accustomed to those types of assessments and provide advice. Now, maybe the people will decline to follow that advice, but at least we're not sticking our head in the sand. What we do is detect social risks as well, because there are risks associated with that. Now, we've seen that there have been more overdoses. If we see that, we'll say to people, well, look, we're hearing that there are dangerous products out there. They might have been mixed with other chemicals, and we can get that information out. If some people who are injecting drugs are also prostitutes or have been in contact with others, at any rate, there's information that can be shared, that can be shared with these patients. We can tell people that they may be at risk. So, in concrete terms, these types of centers enable the type of social contact that isn't available elsewhere, and there isn't anyone who would sincerely prefer those kinds of situations to occur out on the street. To find someone dead of an overdose on the street outside their home, they'd like them to have access to a site. Those types of centers also make it possible to establish a link of trust with those people, and to then, when a person feels strong enough to give up their addiction, there will be someone that they've had interacted with and will in fact be in a better position to help drug addicted people to overcome their addictions. Thank you very much, Mr. Speaker.
The Honourable Parliamentary Secretary to Minister of Labour.
Thank you, Mr. Speaker, and I appreciated my colleague's sort of speech and her perspective on this issue. But I think as a nurse, perhaps she probably had many patients over the years who were absolutely desperate to get into detoxification services, into rehabilitation services. And to be quite frank, those services weren't available. People who are ready to make changes in their lives were unable to get those changes that they needed. So I guess as a nurse, how can she support putting finances and funding into something when she has so many patients who she was saying, I'm sorry, I know that you are looking for rehabilitation services. You would really like to have the opportunity to have a life free of drugs. How she can support that position without having the money spent in terms of where people are really needing it and looking for true changes in their lives.
The
Honourable Member for Abitibt-Témiscamingue. Thank you, Mr. Speaker, and I'd like to clarify that there are services for people who are dealing with addictions, and to date, access isn't as difficult as that. Where the difficulty lies is in convincing people to turn to them. It's difficult to tell people, well, that's what you need, and to do so. Now, if we take an approach where we say what you're doing is unacceptable, we criticize them, you just have to detox, instead of saying, well, we'll be here to help you once you're ready. We're here to ensure that you're not going to get sicker, get AIDS because you're not protecting yourself. And when we tell these people that we're here to help them when they're ready to detox, that's important. What's more difficult is to encouraging people to undertake to give up their addiction. But if we judge them and criticize them before they're ready, then that will have a detrimental effect. It isn't what will help people. What we need to do is provide people a little bit of assistance to convince them to change.
North.
Recognize that there are many communities across Canada that have different challenges, and a part of those challenges is to try to deal with the infrastructure of many social injustices that are there. Issues such as drug abuse, which leads to all sorts of elements of crime, let alone other social factors that are not very positive. And what we need to be able to develop is good, solid programming that's going to build upon making our communities in which all of us live in, Mr. Speaker, not just the suburbs, but all of us live in a safer environment. And when we take a look at injection, in particular the one injection site that we have here in Canada, that I believe that there are studies that will clearly demonstrate that the community as a whole has benefited, not to mention the individuals themselves have benefited by these sites. And if she might want to provide further comment in terms of how it is that the community as a whole does benefit, obviously knowing that the individual in question benefits as well.
Abitibt-Témiscamingue.
The Honourable Member for Abitibt-Témiscamingue. 1 minute remaining. Well, thank you very much, Mr. Speaker. Yes, society does benefit because there will be fewer syringes on the streets, fewer people who are going to be overdosing on the streets. So, yes, communities do benefit. Some smaller communities won't necessarily have supervised injection sites, but they will integrate concrete measures. And this isn't something we saw 10 years ago, but now we've got nurses working on the streets who've got a backpack, who will carry around things like condoms and other things to distribute in areas where the number of people grappling with the issues aren't high enough to warrant the installation of a safe injection site. But those types of measures work in terms of public health, but they must be undertaken in conjunction with other social measures integrated as part of a comprehensive package. We can't simply have supervised injection sites. We also need to take steps with respect to access to awareness and education, to dealing with poverty, alleviating poverty, other social measures that will help these people to do better. It's part of a comprehensive package, and that measure is part of measures that come under the responsibility of a government. We can't stick our heads in the sand and simply ignore the problem.
The débat. Resuming debate. L'honorable député